room with the fire, sound the alarm, and in both hospitals you would do that by yelling out to get your coworkers' attention, code red, you yell out in a good strong voice. You'd pull the nearest fire alarm box, and you'd have somebody dial extension 1911. That's the same at both the campuses, 1911. That's the alarm step. The next step is C, confine the spread of heat and smoke. How do you think we confine the spread of heat and smoke? Closed doors. An absolutely crucial step and one that's often neglected. Many doors in this hospital are required to automatically close and latch when they're not being intentionally held open. So the doors to this space, public assembly area, are required to automatically close and latch. But there are doors to other parts of the hospital, most notably inpatient rooms, for which there is no requirement like that. Because the more typical situation is you want to be able to see every patient and hear every patient during times when there aren't fires as you're walking up and down hallways. If there's a fire, you want to close all doors. And then the final step, E, typically stands for extinguish. In certain emergencies, it might stand for evacuate, but based on what we were saying to you before about defending in place, we typically try to avoid evacuating. We only rescue people that are in immediate danger and continue as near normal operations in the rest of the space. So that mnemonic, the overall response to a fire emergency: rescue, alarm, confine, extinguish. If you're going to use a fire extinguisher, we use the mnemonic device PASS, P-A-S-S. Pull, aim, squeeze, sweep. Here's a sign indicating that there's a fire extinguisher, so even from the other side of the room, I'm able to see that, even if I'm not able to see the fire extinguisher. If you're going to consider using a fire extinguisher, remain calm. There's no actual fire emergency. This is simply a demonstration.
Good.
Thank you. If you're up to the E step, rescue, alarm, confine, extinguish. If you're up to that E step, you can consider using a fire extinguisher. You ask yourself a couple of quick questions quickly. The first is, are the rescue and alarm and confine steps already underway? The answer to that is yes. You ask yourself, is this a fire that's small enough I can put it out with a hand fire extinguisher? The good rule of thumb is something the size of one of those step-on lid trash pails, something like this size or smaller. Typically, you're going to be able to extinguish with a hand fire extinguisher. If the answer to that question is yes, you ask yourself, do I know what's burning and do I know the right kind of fire extinguisher to use? Most of the fire extinguishers around this hospital are what are referred to as A, B, C, for Class A, Class B, Class C fires. Ordinary combustibles, flammable liquids, and energized electrical equipment. If you're going to use a fire extinguisher, the mnemonic PASS, as I mentioned, pull, aim, squeeze, sweep. So if there was a fire in, what can we all see? There was a fire on some debris on this tabletop. The first step is to pull the pin, which is holding the handle secure. The next step is A, aim. You're going to stand about 8 feet back from what's on fire. You're going to make sure that the fire is in front of you and that you have an exit behind you. In this case, because there's exits on either side, I'm safe here. If, for argument's sake, there was only one set of doors to this room, I would not stand here to fight the fire, because if conditions worsen, I want to make sure that I have a means of exit at all times. If I empty the extinguisher malfunctions, or the ceiling tiles start to give way, I want to make sure that I can back out without having to pass the fire to get to my exit. So aim at the base of the fire by standing about 8 feet back. Make sure that the exit is behind you. Squeeze the handles for as long as you're holding the handles together. Whatever's in here is going to be discharged through the nozzle. And then the final S is sweep from side to side. So